morning. Thank you, Senator Briggs and Representative Staples, for being here this morning. Do a quick introduction of the two of them, and then we're going to get started with our questions. And let me remind you, if you have a question on the topic we're talking about, raise your hand and we'll try and let these two answer it and be as informal as we can and get as much information as we can. Briggs does have a patient waiting for surgery, I understand, so we're going to try to get out of here on time. Senator Briggs is the first vice chair of the Senate State and Local Government Committee and second vice chair of Senate Ethics Committee and a member of the Senate Health and Welfare Committee and Senate Transportation and Safety. Representative Staples, it's his first stint in the General Assembly. He's a member of House Consumer and Human Resources and the Subcommittee and House Health Committee and the House Calendar and Rules. So they both are on health, so they're up to date on all of this. But before we get started asking on health questions, I thought it might be good to give us a quick update on what happened with the Improve Act, the gas tax that's been in all the news this week, and we've seen that it passed, but I guess there's still some consolidation to do in the Senate and House. So give us a quick what happened there.
What occurred on Wednesday morning, it went on in Wednesday afternoon, the House was debating it, and really this is where the controversy was, and maybe if there was some unknowns how that was going to come out. The House went ahead and passed, and by the way, we don't like to refer to it as the Improve Act any longer, because the Improve Act was the original bill. The amendment that passed was really quite different from what was originally proposed as the Improve Act. We like to call it now the 2017 Tax Cut Act. And that's what it is. And it's not the Improve Act anymore. But there is a difference between the House version and the Senate version that will have to be reconciled. The part that's dealing with the taxes is the same in the two. The difference is in the House bill, there's a veterans tax relief portion. It's $175,000, I guess you'd call it a deduction that 100% disabled veterans can take on their homes. That was increased from $100,000 from this past year. The House has that same bill, but it's a separate bill. And so on the Veterans Tax Relief Act, so there'll have to be a reconciliation on that. I believe that what we're going to see is that the Senate bill with that on there will be sent over to the House, and then they would have to concur with the Senate bill. If that doesn't happen, then either the Senate would have to take the Veterans Tax Relief part off, or if they can't agree, it'll go to conference. But both bills have passed, and I know the governor is very pleased with where we're at with that.
Basically, a 6-cent tax.
Now, what it is, it's over the next 3 years, there'll be 4 cents the first year, then 1 cent and 1 cent, and it's the same. That's on regular gas, and then on the diesel tax, it'll be 10-cent increase over 4 years. And the reason this is a tax cut is if you look at $2 gas and you're adding 6 cents over 3 years, so that's about a 3% increase in the price of gas. The food tax cut is 20 cents. That's going to drop an entire percent. So in the last couple of years, we've cut the food tax 1.5%. But if you're going from 5% to 4%, that's a 20% cut. If you look at the revenue that will be generated just by the gas portion of this, there's other parts to it, just the gas portions, and then you look at the savings, the tax savings that families, and you can run this with a 2-person family with 2 cars, a 4-person family with 2 cars, any way you run it. It's not going to be a lot of money, but it will be about a $2.70 a month, $2.50, $2.70 a month savings under this act for the average family. Now, if you got a car with better gas mileage, you'll do better. The other thing I like to point out to people is that the gas tax is this much per gallon. If over the next 10 years the cost of gas doubles, you'll still pay the same amount of tax. If the cost of food doubles, because that's a percent, the savings will be even greater for these families. There's other taxes in there, and for the business folks, there was an F&E tax, a franchise and excise tax cut. We've lost some major, including the major car manufacturer last year out of West Tennessee, one of the mega sites, because of the ethane tax. We had I know Representative Carter, who serves, he serves from Hamilton County. There was not going to be an expansion, maybe even a company was going to move. We had one of the highest ethane taxes in the country. And we think that this will not only allow more new jobs to come here, but some of our existing companies will expand here rather than expanding elsewhere. So I think it's a good deal.
This was something the Chambers, by the way, asked a lot of people to call their reps, and we had some engagement there, so we appreciate it. All right, back to healthcare. We'll go. That sort of gave us a good summation.
Thank
Thank you, Rick. If you want to talk about it, you're welcome.
Not at all. I did enough talking Wednesdays.
All right, healthcare. With the federal government failing to replace and repeal the Affordable Care Act, that sort of leaves us a little bit in limbo about what's going to happen on the federal level, but certainly as well as in Tennessee. I know Senator Briggs, you remember that three-star task force that met last summer to try to come up with some options. Is anything happening in the General Assembly, specifically any legislation to address healthcare, or what's being talked about? And I'd like both of you all.
One of the problems, the answer is, and I can't remember which one you asked first and which one you asked second, but the answer is no, yes, or yes, no. But one of the issues that we have in the General Assembly is that before any plan, any waiver can be submitted to CMS for approval, the General Assembly has to pass permission, has to pass a resolution for permission for the governor to submit that plan. The Insure Tennessee plan that failed in the 2015 session did not fail. We were not voting on Insure Tennessee. We did not vote on that. We voted whether to allow the governor to submit the plan to CMS. The plan was never submitted to CMS because that failed. I had a bill this year, and it was also carried by Andy Smith, and it was really moving well. It had gone through several committees in the House, and on a very difficult committee, it's the one where Insure Tennessee failed 3 years ago. I believe we were going to get a 9-0 vote on it. But, and I won't go into the details of what happened, but there was a request to pull the bill. What the bill would have done, it would have permitted TennCare. This would have gotten us over the hurdle to allow TennCare and the governor to go ahead and submit a proposal to CMS. Now, what the proposal was going to be, we didn't know, because we didn't know what the federal government was going to do. This was right at the time, I think it was 3 weeks ago today, when the American Health Care Act failed. That was Speaker Ryan in Washington. But we had this to where we could have requested, depending on what Congress did, a block grant, a plain block grant. We could talk all day about what that means, a per capita cap block grant. We could have resubmitted something in the form of Insure Tennessee, or we could have made some iteration or variation of one of those. This would have gotten us over the legislative hump. But it was decided by some of the leadership that bill was not going to go forward, even though it looked really good, because they, I'm trying to think, I have to say this politely, I'm not very good at that. They didn't trust what TennCare was going to submit. And I even told them, and I reminded people, that it's the legislature that funds any program that we have. If a plan was submitted to CMS that was approved, and it came back to the legislature, if it was a plan that the legislature didn't like, they could just not fund it and tell it that there was some other reasons why it didn't move forward.
Rick, what's happening in the House and the Health Committee?
Well, to go to Dr. Briggs' point he made about the bill that Representative Smith was carrying, Senator Briggs was co-sponsor on. We did expect that a few times in the Health Committee, but it was taken off notice. And Leader Fitzhugh, Craig Fitzhugh, has a Medicaid expansion bill that we haven't heard yet.
Might come up this session still?
We're looking for it to come up before the Health Committee closes out. Health Committee is one of those, like Finance will be one of the last committees to close. So we're looking to see that. I know Leader Fitzhugh is real good about keeping his calendar out. So we don't know really where that's going to fall. But we're looking at close to a little over now, 300,000 Tennesseans that's still without health care. Everybody kind of got distracted with the IMPROVE Act. And so healthcare kind of lost a little bit of concentration. From the Democratic side, I'm not trying to make this political bipartisan, because I already looked at Senator Briggs a lot for help. He's been great assistance to me. We've really still been in conversation with the governor about Medicaid expansion and doing something about healthcare, because meanwhile back in the branch we may have passed the 2017 tax cut. But we still have Tennesseans that can't get healthcare, can't get healthcare needs, and are actually truly still dying. That's not to be shocking or make a shocking statement. A lot of people are dying across the state because they can't receive healthcare. So my hope is that even President Obama asked for ACA to be repaired and not repealed. So instead of going back for the fight, I hope on a national level, and maybe even a governor will visit Washington and maybe appeal to repair some of the issues that we have. ACA does need repair. It's already in there. It will take a lot to repeal and to come back into place, and we have to go back to the conversation of block grants and how that would fit. We just don't know, and it'd be too much experimentation, and those numbers of individuals in the state of Tennessee that would go uncovered, uninsured, would increase. So if we could just get in there, hopefully, and just do some repair, come back to the state level, do some expansion, I think we could possibly get that done at the first of the year. Or now, I'm not calling this, maybe even call a special session sometime this year to get some sort of legislation passed.
I'd like to add one more thing. Well, I think it's critical that we do something. The proposal, and we don't know what's going to come in the future, but one of the things that was being talked about very seriously is converting the entire Medicaid program to a block grant type program and taking it away. Right now, this is a state-federal partnership where the state puts in $1 and the federal government puts in $2 for Tennessee. If we go to one of these block grants, and the thing that would be the safest for Tennessee if we have to go to that would be a per capita cap block grant. It could be based on how much money that the state receives. The original one would have had 2016, and unless something special was done for the 19 Republican states that didn't participate in the Medicaid expansion, it really would have been devastating, I think, because these other states would have been receiving, per state would have been receiving billions of dollars more every year than Tennessee would. What we've seen now, since the states have looked at what the federal government is really talking about, I think it's Virginia, North Carolina, Georgia, Iowa, and one of the others, just all of a sudden, I mean, this is in the last 3 weeks, have put bills forward to expand Medicaid. And the reason they're doing it is because since the other bill failed, they may base the federal dollars on what you receive in the year 2017. And if we're not receiving more federal dollars, when it comes down to some sort of block grant, we're not going to get as much money. And it's going to be really challenging. And it's absolutely critical that if we go to a block grant program, that the mandates are taken away. We had 100% or almost 100% of our citizens covered between 1995 and 2005, 2006 under the original TennCare program. The problem is that hospital costs weren't going up too much. It wasn't the doctor's cost, but it was the pharmaceutical costs that were just going up exponentially. It was about to break the budget. I mean, it was projected it was going to take 40% of the entire Tennessee budget just to pay for health care. We could have managed that if we could have managed pharmacy costs, but the federal mandates didn't allow it, and there were a set of suits against Governor Bredesen, a good Democratic governor, and you heard it from me, but he was a good, he could have fixed that program, and today we could have had 100% of Tennesseans covered. The benefits, the pharmacy benefits in particular, and maybe some other benefits would have been less, but the 10 federal mandates that are part of the Medicaid program, they were unmovable. CMS was unmovable, and these whole series of lawsuits left Governor Bredesen with no choice but to disenroll over 100,000 Tennesseans.
I guess a question I would have is sort of a follow-up to both of you asking that, but I think all of us would know Insure Tennessee didn't get much support at that time. because President Obama was in office, and frankly, the legislators that I talked to said we don't trust what's going to happen, and so we really don't want to get involved in that. We had a regime change in Washington. Do you see a softening toward that?
My bill would have allowed whatever we needed to be sent as a waiver request to CMS. And probably CMS now is more amenable to agreeing to these things than it was even in 2015 because of the change in the administration. I want to remind the bill that I had this year that got pulled by the leadership, and it would have passed the committees. That bill would have allowed us to have done whatever was best for Tennessee, depending on what the applicable federal law was. I want to remind everybody also that the state of Tennessee has lost about $1.2 billion a year by not expanding Medicaid. And, we can talk about, Rick has done a very good job talking about the human aspect of the 300,000 Tennesseans that don't have insurance. $1.2 billion a year is a pretty good boost for our economy. I mean, this is an economic issue. We've had 9 rural hospitals close, and the Tennessee Hospital Association tells me there's another 13 that are in jeopardy. So this is absolutely critical. I mean, this is critical for our state's economy. And if you recall, last September, we had a special session. Special session brought everybody back for a week to get $60 million, one time $60 million for our transportation funds. That $1.2 billion is 20 times that every year. And we said we didn't want it.
As I think everybody in this room knows, that we don't have any current carriers who are going to provide the exchange in Knox County starting next year. And on the federal level, Senators Corker and Alexander tried to do a bill that would address that. Is that something you all are talking about?
Yeah, well, I've talked about it with our Lieutenant Governor. Unfortunately, a lot of this is going to have to be handled. What it is that Senator Corker and Senator Alexander have a bill proposed, if you don't know, in Knoxville, the health insurance exchange and the 16 counties surrounding Knoxville. Humana was the only provider we had last year. Blue Cross and Cigna had already pulled out. But now Humana said in 2018 they're not going to participate. So we have no one in our health insurance exchange to buy health insurance from. The Corker-Alexander bill does a couple of things. One, it would allow the families and individuals and people, and this is not just poor people. I tell you, when Humana pulled out, I had doctors and lawyers and business people calling me because they had private practices, small. They were buying, now they didn't get the subsidies, but they were buying their insurance off the exchange. It's almost impossible to buy individual policies. I don't care how much money you make.
It's not almost impossible, it is impossible.
It is impossible.
It is impossible.
It is impossible to buy individual policies, so you can have people making $500,000 a year that can't get health insurance. And what the Corker bill would provide is that people could go to some of the other exchanges in Tennessee. Nashville still has participants in it. You could go to Nashville and buy your insurance, and if you had subsidies, you could use your subsidies on those exchanges. And also there would be a waiver on the mandate to have insurance. You know, now if you don't buy insurance, you have to pay a penalty. But this would waive the penalty for the people in those counties where there's no health insurance available.
And to add to that, as some of you know, prescription medications are priced differently across the state. So that's another damaging issue that affects everybody, no matter what your socioeconomic background. So there's no way for us to right now to regulate what the prescription prices are, and that's hurting a lot of people. And this thing is cyclical because it's just like a wave going out. If we're having all these issues and losing so much money going out of state, it hurts business recruitment. It hurts individuals want to move to Tennessee. So eventually that's going to affect our state tax base. So that's an issue that we have to address really kind of right now, as quickly as possible as we can, to look at that. So going back once again, I have hopes that maybe we'll go to Washington and make some sort of appeal. And so we can try to, now I'm not looking forward to going back to any special session, I want you to understand. But we need to do something This year, if it takes having a special session to get something regulated or done, we need to do that immediately.
What is the status of that legislation? Do you have any idea in the federal, where it is? I know Senator Porter's in town.
I really don't, I don't know anything more than what I read.
I'll find out
in the
this
paper.
evening a little bit, so I know it's something they have in fact worked hard on. All right, anything else? Yeah, go ahead.
Monitors are overseas when a carrier participates the plans, because we're seeing the plans are out there now, and they are not affordable care. They're covered through the exchange policies, but they're not affordable care to the folks. So who oversees, if a carrier comes into the marketplace, who oversees the policies that are in place?
Well, what they have to do, they have to go in front of the insurance, the State Insurance Commission for rate increases. And as you know, it was last year, Blue Cross had approval for a 62% increase, Cigna's was 40, and Humana was 42%. And this is what they talk about, the death spiral. The problem was we had not enough low-risk people participate into it. In other words, the penalty for the mandate for not participating was low enough that if you were pretty healthy, maybe in your late 20s, the penalty was less than what your insurance premium. And to be perfectly honest, if you were buying a policy and it was a $7,500 deduction and you're paying $400 a month in premiums, it's like not having insurance unless you have something catastrophic. And then as the premiums got more and the benefits got less, the healthcare people continued to drop out. Now the people that did have health problems would still buy in, because it was still a good deal for them. But that's what caused the death spiral. The state, I talked to the fellow that's the government relations person for Blue Cross Blue Shield, a fellow by the name of Bill Locke. He's a very, very good man, very nice man. But he said Blue Cross and those plans had lost $500 million. And he said those are non-sustainable losses for Blue Cross on that particular plan. And obviously, Cigna, Humana, and these others said we just can't take losses that high.
But before we participate again as a state, wouldn't it be wise to look at how that impacts the individual in utilizing those plans?
There's really two parts to the Affordable Care Act. You have the part that's the Medicaid part, and that goes up to 138% of the poverty level. We have 3 MCOs that advantage it. Now that's actually doing well. The people that are in it in Tennessee are doing well. The medical inflation in the TennCare program is only about 3.6%. That's pretty darn good. That's one part of it. That part's working, only we don't have enough of our citizens in it. We're turning down money on the Medicaid. That's when I talk about the $1.2 billion per year. The other half of the ACA is the insurance exchanges. And these are people that make over 138% of the poverty level. And between 138% and 400%, they get subsidies that can help pay for it. Now, even individuals that make over 400% of the poverty level can go and buy insurance. And that's why the doctors and lawyers and accountants were calling me. But that's the part that the state sets the rate. Because the people in the Medicaid program, the people don't pay any premiums for it. That's an entitlement that you don't pay anything for.
So you have an entire class of people that are engaged in small business, right? And if you take a look at that, take a 10-year window on that, about, given whatever 10 years you look at, most net new job growth is in those businesses.
You're right. Yes.
They're under the
small businesses are where the job growth is.
They're talking about they're under the 50 mandate, right? So they're not mandated to provide medical insurance as employers. But now most of those people's employees can't get insurance. And most of them actually get paid above that poverty line, so they can't get subsidies either. They don't qualify for TennCare, and they can't get insurance on the exchanges. And that's a huge gap. I hear all the conversation about TennCare and Medicaid and all those things, and I think it's great to talk about that. But I don't hear any conversation about fixing that gap.
Well,
Where most of us live.
That was what Insure Tennessee was.
Yeah, see, a lot of that's what Insure Tennessee was. A lot of that is what Insure Tennessee was going to do. But we still have a problem. I think we could have a half-a-day seminar on about healthcare policy and what the problems are in the country. And I tell you, I could sit up here on the board and draw you up some advantages and disadvantages. I don't want to go off on a tangent too much, but you can have government insurance, government care, government insurance, private care, private insurance, private care, and then pay as you go. Those are the 4 systems that you can look at. We could spend like a half a day on that, but I won't.
I'll tell you, Dr. Riggs, Fixing franchise and excise taxes matters for those smaller businesses, but not nearly as much as fixing this problem.
I agree.
Because you need
And
to
I've been
work-
coaching those businesses for 30 years.
I agree.
And they come to me and say, hey, coach, here's my big problem. My best employees leave because the big companies have medical insurance and I can't get it. And so those people are struggling and suffering every day.
See, we've taken, and I don't want, just, we've taken human beings and we have made them abstract when we discuss medical care in the state. We made them very abstract and a number. And the reality of it is, if you look at the state seal, it says agriculture and commerce. Tennessee is a state of business. We need that. In our state, we have some great large businesses here, but the majority of our state is made up of the small business. And so that's the crux of who we are as Tennesseans. So once again, and just to add to the points, we know the numbers, we know the issues, we know the concerns. We're literally, as legislators, we're going to have to stop, turn around, and address this issue right now to get this fixed, because we are losing our workforce and we're not able to recruit. So even though we may have a surplus right now, that's really not going to help us if we're not able to get the businesses in here, get our kids educated, create a workforce, and continue to sustain our tax bases across the state. So I appreciate your point. I wanted to say that. Thank you.
Dick?
One of the things that's affecting the cost of insurance is the skyrocketing cost of medicine. I think you mentioned that earlier. Since I retired, I have an opportunity to watch television a little more. I do every other ad on any program that has to do with medicine. They've actually surpassed the car companies, I think, in advertising. I saw something, or heard something very interesting on the news the other night that I had never been aware of. There was an item on the news that said that the United States is one of very few countries that permit makers of medicine to advertise. So it seems to me there's a direct correlation there. Would you comment on whether it would make sense for the federal government to restrict medicine manufacturers from advertising, because that might lower the cost substantially?
I wish they would, but I believe that came up a number of years ago, and I think it's a constitutional issue. First Amendment.
So we used to advertise for cigarettes, we don't have that anymore.
That's what the Supreme Court. She's the moderator.
You touched on why your bill was pulled, and for those of us that speak to the Knox County Legislative Delegation all the time and lobby people all over the state to try to get legislation passed, explain to us a little bit, both of you, about how things work in the House and Senate in terms of how the leadership can pull bills sometimes that maybe the Calendar and Rules Committee would like to put out on the floor, and what maybe we can do as citizens and as business people to try to get legislation like what you're trying to do passed.
I'll tell you exactly what happened with mine. Eddie Smith started running the bill before I did. I think it had already gone through a subcommittee, maybe even a committee. I mean, it was flying. We got it through one of our committees over on the Senate, took the Commerce, which is generally a tough committee. When I presented it the first time, I could see it was going to run into trouble, so I went ahead and said, let's roll this a couple of weeks. I went and spoke to each one. There's 9 on the Senate committees, and I went and spoke to each one of them. Matter of fact, the chairman of the committee, Jack Johnson, made one minor. This was a short bill, maybe 3/4 of the page long, because it was vague. It just said, according to applicable federal law, they used that term because we didn't know what the federal law would be at the time. If it's in the best interest of the state of Tennessee, that TennCare could submit a waiver to CMS. And so I thought we had it covered, but it would get us over that legislative hump where the legislature would give approval for CMS to submit the waiver. I got up there literally the day to do it. I knew I was going to have 9 votes. And someone came in and handed a message to the chairman, and they said, he said, I got a message here to put this on the last day of the last calendar. I went and talked to some of the leadership about what was going on, and they said, well, we want to study this a little bit more. And then the chairman called me a couple of weeks later and said they want the bill dropped entirely. And what we have, and I went back and talked to him again, and what the reasoning was, is that, and I told him, I said, look, if we don't like this, first of all, we don't trust what they're going to do. And I said, well, that's okay. If they send back a bill, if they send something back, we finance things, they don't. We can just not, we've got the checkbook. So someone said, because I know someone at the first meeting said, well, we're just giving them a blank check. And I said, well, we're giving them a blank check, but there's no money in the bank unless we put it there. And because that's the role, that's the constitutional role and duty of the legislature. So anyway, I went and talked to them, and here's, I guess this is politics, is that they said if a bill went to CMS, or a proposal went to CMS that came back, they were concerned that then people would have to go on record of voting for or voting against it, they didn't want to put people in that position. And to me, that's, in my opinion, my humble opinion, that's some of the worst reasons for politics, is just to take these rural areas. Randy Boyd, you all know Randy Boyd very well, and I'm not putting in I will put a kid. But, never mind that, strike that remark. Anyway, he said when he was the Commissioner of Economic Development, he says, I cannot recruit industry and businesses to these rural areas when their hospitals close. He says, I can't do it. And we've had 9 rural hospitals close. Most of them have been in West Tennessee, but as you know, the Scott County Hospital in East Tennessee and the Jellicoe Hospital is having difficulty. If you look even in our community in Knoxville, with a very diverse economy, some of the best paying jobs and the largest employer is going to be the healthcare industry. You go to Jellicoe, they have about 500 people work at that hospital. I can guarantee you those are the best jobs in the community. And I'm not talking about the issue even that Representative Staples was talking about here about the humanitarian aspect of it. And we're talking about health. I want to bring this up too. Every year we get a report. This is a national report. We're really proud that we have, and we're going to have even better, some of the best roads in the country. We have the lowest tax burden on our citizens. We're a very pro-business environment. We've made tremendous strides in education. We're still at the bottom in health. And if you look at the number of days absenteeism from work, there's only 6 states that people miss more work than they do in Tennessee for physical illness. So this is a business issue too.
Yes, I can.
Yeah, I was wondering, has the federal government communicated to the legislature what the national Medicare debt is?
Medicare is a federal program. Now I will say that we do, part of our Medicaid program deals with the nursing home for the elderly. And we do have a partnership there, but Medicare is a federal program. And we don't.
I was just asking if they communicated to you what the debt is.
No, we don't. I mean, we don't deal with
On a regular basis.
Here, you can talk. I mean, I know what it is, but it's
I'm
not
trying to feed everything to him to get him to talk. Right?
I'm the shy one. Go ahead.
On a regular basis, no, but I know that our Republican senators have stayed in communication with representatives of the Knox County delegation as far as some of the issues that they're dealing with. And it does help that Senator Massey has a brother that's in Congress as far as being able to reach out, having to deal with to red tape. But to go to your point earlier, sir, as far as the bill once again that Representative Smith and Senator Briggs carried, just to be transparent, it had made it to the full committee of health. As you know, it's so kinetic and so busy up there, and we all had our own bills to deal with, and there was a few controversial bills that were coming through health. And I know that bill was rolled a few times in the health committee, and then it was one of those bipartisan bills. The Democratic Party and the Republican Party both seem to have liked the language of the bill and what it did, but the next thing we know, it was taken off notice. And so once the bill is taken off notice, it either has to be brought up, because this is just the first half of the session. So next year's the other half. So it may be brought up next year, because you have to make sure that the language is right, then you have to turn and get with the experts. If I have an issue about opiates, there's an expert in the room, I'll hear to get your language right so it doesn't get hung up anywhere. It seemed like the language was right, it seemed like it had the support, so not quite sure what happened. And it seemed like, just to be transparent once again, that it had the votes in the committee, so.
I'm going to ask one local question. The budget discussions begin, I guess, next week. Rick, is there, we've talked many years in here about the safety center, which is now called the behavioral something center, behavioral health center. Is that, are we going to see some state money come to Knox County to help fund that? Are we hearing that?
There are state dollars committed to that, and it will be coming to assist with that, so that's already done. That hasn't
Do
been.
you think we have enough support to?
Yes, that's been fully supported, has been an issue, and it should be some funds coming to assist with getting that going.
Anybody else got questions? Jim, while we have them? Well, just one last question, and we'll wrap it up. That I know Senator Briggs, and actually you too, Representative Staples, been very concerned about the opioid addictions and pill bills, all of that, and I know you've been very engaged in legislation. Anything new this year? We still don't seem to be on top of this. It continues to be a problem.
And I'll turn it over to Senator Briggs. We have been working on several pieces of legislation that have come through to try to assist with addiction and make sure there's money there to deal with that. Opioid abuse is just so high here in Knox County, and as you continue east, in Cosby County and whatnot, it's very bad. It's almost sad. We're dealing with a lot of children being born with those addictions now as well. This snake really came out of the grass. We didn't see it crawling, and it just kind of caught everybody off guard. But legislators have once again been are really strong and committed to work in a bipartisan manner to address these issues this year with monies to go to deal with addictions, and also the criminal element to make sure that we're punishing individuals that are supplying or abusing that. So that hasn't been a hiccup this year, and it's run along pretty smoothly on the outside.
Just very quickly, we have Karen Pershing, who's the real expert on this in here. One of the things I think that we need to be proud of in Knox County, almost every bit of the legislation dealing with opiates in the state of Tennessee has come out of the Knoxville Metropolitan Drug Coalition. I mean, we are absolutely the leaders in the state. One of the things that we did come up with this year is that it is more regulatory than it was codified, deals with the regulations on, I call them the Suboxone clinics. These are the rehab clinics that, and Suboxone is one of the medications they take for what they call medication-assisted treatment. And it's, people ask me about that, and it's a solution, and it's also a problem because it can be diverted. And these are completely different clinics than the pain clinics. One of the things that we do have coming online on the 1st of July is from a bill that we passed last year, is we will start, the health department will start inspecting the pain clinics, and they're going to be licensing the pain clinics, which we've never done in clinics in the past. And I think that's going to be a very important piece of legislation. What we're looking at now also, because for instance in Knox County, I think Chief Roush would tell you we've gone from 39 to 18 pain clinics, and that's pretty good. Our pain clinic directors now all have to be pain-trained doctors. They're not just someone that hangs up a shingle and you pay your money and get your dope. That's not what's being done any longer. So I think we are making some progress. I really, it's going to be a struggle. But one of the things that we're looking at now is trying to put more money into rehabilitation and getting people off drugs that are on it. And a bill that absolutely, you never know what the legislature is going to do. Senator, it just absolutely shocks me sometimes. Senator Dixon, he's the marijuana guy in the Senate from Nashville. He came to me and sat down in my office and he said, I'm going to propose a needle exchange, clean needle exchange for the addicts. And I said, Steve, have you gotten to that stuff you're trying to make legal? I said, you're crazy. You're going to be the only guy voting for this thing. He brought that up, made a very good case. I actually started working with it the more I thought about it. And called Chief Roush, called Karen, sent an email to her. I said, what in the world? I said, this is really a pretty good idea. That darn thing passed the Senate 32-1. I mean, it went through the committee, 9-0, 32-1. I mean, who would have thought it? Amazing. And what that'll do is that they have to have wraparound services, and again, it's trying to serve as a bait to get people in to where we can get the reproductive age women on birth control so they're not having babies addicted, and also maybe get some of the people into rehabilitation. Because I think rehabilitation is where we're going to have to focus something on now, because we have all these addicts out here that we need to do something, need to try to do something with, because they're probably not going to get off on their own.
All right, that's it for the morning. Thank you all very much.